Good evening, everyone, and welcome to our session this evening on contraception confusion, options and consequences. My name is Sarah Tressis, and I work as a Yoetza Halacha in New England through the New England Yoetza Halacha Initiative. And I'm very excited to talk with you this evening about birth control with my sister.
Hi, I'm Rachel Wienerman. I'm an infertility specialist at the University Hospitals Case Western Reserve University in Cleveland, Ohio, where I also specialize in reproductive endocrinology and infertility. And I'm also very excited to be talking to you about contraception with my sister, Sarah Tressis.
As a Yoetza Halacha and a college teacher, I get a lot of questions about birth control. And sometimes the halacha question needs a medical lens to answer it fully. And I feel very fortunate that I can always consult with my sister, who is an expert in this field of medicine. And I'm really excited to partner with her tonight on this topic of birth control.
And similarly, a lot of my patients have halachic questions that come up during their medical treatment. And I always call my sister Sarah for halachic advice when dealing with situations that require her expertise. So we've always talked about wanting to do something together that combines our expertise in this area. So we're very excited to be able to share that with you tonight. So the goals tonight are a few. So we're going to talk to you about how contraceptives work and help you understand why you might choose one type of contraceptive over another.
We'll also go over the halachic implications of different forms of birth control with the ultimate goal of empowering you to have a more informed conversation with your doctor about finding the right birth control for you. This evening, we'll talk about different types of birth control, beginning with combined hormonal options, then progesterone-only options, IUDs, and finally, a bit about barrier methods.
So before we talk about contraception, I think it's really important to understand a little bit about the menstrual cycle and how your body works to get a regular period. So in order to understand how birth controls manipulate the period, let's understand a bit about how the body works normally. So, in a typical month, your ovary is going to produce an egg, and that is going to make you ovulate. This takes about 2 weeks. And during that time, your ovary is producing a hormone called estrogen. Estrogen works to build up the lining of the uterus to make it thick. During the second half of the menstrual cycle, after you've ovulated, the ovary produces a different hormone called progesterone. Progesterone's role is to actually organize the uterine lining to make it receptive to a pregnancy. It actually gets it ready for a pregnancy. Now, if you're not pregnant, the progesterone goes away after 2 weeks. And that progesterone going away is what signals the uterus to shed the lining, and that's what gives you a period. So you get a period every month because it takes 2 weeks for the ovary to grow the egg, and then 2 weeks for that follicle to go away and shed the lining. And again, the first half of the cycle is predominated by estrogen, and the second half by the hormone progesterone. And those two hormones together give you a period every month.
So with that background of what normally happens, let's get into what birth control will do to your cycle. So we'll begin with dual hormone options, the combined pills, patches, and NuvaRings. In talking about combined pills, we'll speak about how they work, how they differ from each other, side effects, and then the halachic implications.
So let's first start by talking about birth control pills. So I just told you about how your body ovulates every month. With the birth control pill, it's a combination of estrogen and progesterone that works together to stop the body from ovulating. And that's really how it works as a birth control pill. It prevents you from ovulating and from getting pregnant. Now, each component of the pill does this in different ways to make it very effective. So let's first talk about the progesterone component. Now, I call it a progestin because it's actually not progesterone. It's a synthetic progesterone called a progestin. And this is the main component of the birth control pill that causes the pill to work. So it's the progesterone component that prevents ovulation. So it stops the body from making that egg every month. So because of that, your body is not naturally going to get a period on its own. So the reason that you get a period every month on the birth control pill is because when you stop taking the active pills, a lot of birth control pills have what's called a placebo week. The last 7 pills are not active pills. They contain what we call sugar pills or placebo. When you take those pills, you stop taking the hormone, and that triggers your body to have a bleed. Just like in a normal menstrual cycle, stopping the progesterone is what actually triggers a bleed. So when you take the progesterone component of the pill, stopping the progesterone causes a bleed, but you are not ovulating on the pill because the pill prevents ovulation. The progesterone of the pill also thins the uterine lining and affects cervical mucus and sperm movement in the fallopian tube. Now, the birth control pill also has another component, which is estrogen. The estrogen component of the birth control pill helps to stabilize or thicken the uterine lining. It also prevents a follicle from growing. That means the cells surrounding the egg. That helps to prevent cyst formation. And it also helps to make the progesterone component more effective. So if you only have progesterone, it's not quite as effective, and we'll talk about that later. If you have a combination of estrogen and progesterone, the estrogen actually helps to make the progesterone more effective in preventing ovulation. Now, this combination of estrogen and progesterone does have side effects. So the birth control pill is known to have side effects, and it differs by woman. But common side effects include irregular bleeding and spotting because these two hormones together are regulating the thickness of the uterine lining, and the hormones are basically taking control of the cycle. So sometimes there can be bleeding that happens irregularly as a result. Estrogen can cause nausea, headaches. The combination of both hormones can cause bloating and mood changes. And it is very common on the birth control pill to have decreased libido. Now, one of the rare side effects of estrogen, but is very important to know, is blood clots. So any birth control pill that contains estrogen or any birth control that contains estrogen is going to increase the risk of blood clots. So women who are at risk of blood clots should not take estrogen-containing birth control. Now, one thing that's really important to know is how do birth controls differ from each other? There are a lot of birth control pills on the market. And if you're trying to start a birth control pill, you may be thinking, how does my doctor choose which pill to start me on? So birth control pills differ from each other in a few main components: the dose of the estrogen, the type of the progestin that's used, the length of the active pills, and then whether they're monophasic or triphasic. Monophasic means that the same dose of the pill is given the whole month, and triphasic means the dose of the pill changes each week.
So we put together this chart, which contains some of the common estrogen pills that are used by women who consult with me. And if you see in this middle column, this is the amount of the estrogen, and it ranges from 10 micrograms down up to 35 micrograms. And then the last column, you'll see the type of progestin that can vary by the pill. So if you have, these options plus more that we didn't include in the chart, Rachel, how do you know which pill is right for you?
Excellent question. As a doctor choosing a pill for a patient, there are a lot of considerations that I take into account when choosing the right pill for the patient. So the first thing that I think about is the estrogen dose. So, a lot of, like you saw, there's ranges. So there's 10 microgram, which is at an ultra low dose pill. There's 20, which is the medium dose, and then 30 or 35, which is still a low but higher dose. No pills have as high a dose as they did when they first started. Some women want a lower dose estrogen because it does have the potential for fewer side effects. And some women like that. They may have more nausea on a higher dose pill, and they may want the lower dose that they can get. The problem that some women have with the lower estrogen dose is that the lower estrogen doses can lead to more breakthrough bleeding. Some women need a higher estrogen dose to stabilize the lining. So some women may not tolerate a lower dose because they may have too much irregular bleeding or spotting. They may need that higher dose to have a regular cycle. Now, women who have irregular periods, for example, something called PCOS, may also benefit from a higher estrogen dose because higher estrogen doses are also better at controlling symptoms like acne that the birth control pill can help with. The other thing that we pay attention to is the type of progestin. So each progestin has its own side effects. And some progestins are formulated to be more what we call androgenic or similar to testosterone, and others are anti-androgenic, meaning actually against testosterone. So there are some progesterones that are formulated to be better at controlling acne, for example. Although I want to emphasize that all birth control pills will be better for acne than not taking birth control pills. Now, there is the option of monophasic versus triphasic. So monophasic pills will have the same dose the whole month. And that really gives a lot more flexibility in terms of being able to schedule your period and some of the other things that we'll talk about later. Triphasic pills, the dose changes. Some women do like that because they do feel it helps with their bleeding. But I would say for most women, a monophasic pill would be my first choice. Then the length of the active pill is really an interesting choice. So in general, birth control pills used to always be 21 days of active pills and then 7 days of pill-free week. That's changed recently. There's a lot more options. There are some pills now that have 24 active pills and then 4 pill-free days. The reason for that is that it gives fewer side effects to some women who do have side effects from the hormone withdrawal days. And it can also be better for bleeding control for some women because it gives shorter and lighter periods. There are other pills that actually don't give you a period at all every month and have 84 days of active pills. That's a brand called Seasonal. And then they give you a withdrawal bleed only every 3 months. There's a lot more flexibility with the cycle scheduling with the different length of active pills.
So let's move on to some halachic questions that I receive. So I do get a lot of questions about the pill, but the bulk of them, I would say, revolve around spotting. That women who have breakthrough bleeding on the pill, either while they're getting used to it or if they miss a pill in the middle of the month. So I want to emphasize that not all spotting makes you nida. Now, when it comes to seeing a stain or spot, sometimes it renders a woman nida and sometimes it doesn't. So when you do see a stain, you want to ask yourself these 5 questions to see if the stain makes you nida or not. The first one is, what color is it? So if the stain is red or black, that is nida. Other colors, including most shades of brown, would not render woman nida. The second question is, what size is it? It has to be what in the halacha terminology is a gris, which is about the size of a penny, or some use the size of a dime. The third question is, what color material is it on? It only renders a woman nida if it's on a white material, or white or off-white material. Other colors would be fine. The fourth question is, what kind of material is it on? And this includes something that's synthetic, like a plastic or a polyester. It includes things that are on the ground or connected to the ground, like a toilet. And it also includes things that are disposable, like toilet paper or a panty liner. There are opinions that feel differently about those. The last question you want to ask is, can it be from anything else? Do you have a cut? Do you have, you saw a stain on a towels? Do you have a nosebleed? Again, nida is only caused from blood that generates from the uterus. So if you have a vaginal cut or something like that, that will not render you nida. There are 3 scenarios to be extra careful about. Those are, number 1, immediately after urinating. So I mentioned toilet paper was disposable, but if you would see blood immediately after you're urinating, that renders you nida. So you want to make sure to wait before you wipe. The second one is anything internal. So if you would see even a small amount of red on a tampon, that would be nida. And the third one is after intercourse. Now, there's a lot of details in all of these categories here. There actually is another yoetz that is giving a 10 talk. If you check out in the conference 10 talks, a whole 10-minute class on stains and which ones are nida and which ones are not. But in general, if you do have spotting from the pill, you want to consult with your halachic authority to see if this renders you nida or not. Some other questions that come up include, can I skip the placebo week? Meaning, can I not get a period and just take my packs back to back? So on a purely halachic level, that's actually fine. There's no mitzvah to being nida. The mitzvah is, if you become nida, then you go to the mikvah before being with your husband, but you don't have to become nida every month. Can you talk about the medical side of that? Is that safe to do?
Yeah, from a medical perspective, there's no medical reason why you need to have a period on the pill. The traditional pill has been designed to get a period every month, but you don't necessarily need that to make the birth control pill effective. So it's completely fine to skip the placebo pills and go straight into the next pack, and then you won't get a period that month. It will not change the effectiveness of the pill. And then, you can schedule a period when you want. Now, some women may find that when they skip the placebo week too often, they will get breakthrough bleeding. So it is very common that if you don't give yourself a period too frequently, that you may have an instability of the uterine lining and have spotting. So if that's annoying or halachically problematic, then you may need to give yourself a period more regularly, just so that you have, more stability or predictability in your bleeding. But every woman is different. You can sort of see how your body is. Some women can tolerate having no period for 3 months and do fine. Some women do need a period every month just to have that, more stability in their lining. But in terms of, from a medical perspective, you can take the pill for a year straight and not have a period, and it would still be fine. And if you do get breakthrough bleeding, it does not change how effective the pill is in terms of its contraceptive abilities.
Yeah, so when I usually advise women that when they're on the pill, active pill for a long time, and they start getting the spotting, again, even if that spotting does not render you nida, we recommend women not to actually have intercourse while you're spotting. So maybe it will turn into a flow or cause you to be nida if you see blood afterwards. So it could be annoying to manage. So typically what I would say is, once you start having some spotting, just take the placebo, get a full period, let your body refresh, and start the active pills again. And oftentimes you can kind of build up like a longer tolerance. So you can push every month, like how long you can be on the active pill for before you start experiencing that breakthrough bleeding. Another question that comes up is, what if I miss a pill? So oftentimes this would relate in some breakthrough bleeding. And again, halachically, that would be, ask yourself those questions about where do you see it, how big it was, etc. On a medical side, what happens if you miss a pill?
Yeah, it's a good question. And a lot of it depends on what pill you're on, where you are in the cycle. So it is really important to, look at the instructions that come with your pill and also talk to your doctor. But in general, if you miss one pill, you should, and you remember the next day, you should take both pills the same day. So take it as soon as you remember, even if it's 2 pills the same day, and then keep going with your pack. And you should still be protected from pregnancy. If you miss more than 1 pill, then you should take 2 pills as soon as you remember. You might end up missing a pill, but you may need to use backup contraception for a week. And then depending on which week you're in your pack, you may need to skip that placebo week, that pack, in order to keep making the pill effective. So if you do miss more than 1 pill, in other words, if you miss 2 or more pills, you should call your doctor.
Another question that comes up is, what if I don't get a period at all when I'm on the placebos? I'm hearing this question more and more from women who are on the low estrogen pills or the low estrogen pills, where either they won't have a period at all, or they'll have a bit of spotting. It's not really a flow at all, just some spotting on the placebos. So halachically, it's a really interesting question when you have just some spotting, because on the one hand, this is, it's coming at the time of a month where your period would come. But on the other hand, it's just spotting. It's not a real flow. And there are different halachic authorities deal with this in different ways. So it's worthwhile asking your halachic authority how to proceed about that. Again, medically, is that normal? Is that okay?
Yeah, so from a medical perspective, it is normal and expected. So one of the benefits of the, low estrogen pills are that they have fewer side effects and they keep the lining really thin. So, it is not uncommon for women on these pills to have a very thin lining, and therefore when they stop the pill for that placebo week, they don't get a period at all. There's nothing wrong medically with that. It's just saying that the lining is so thin, there's nothing to shed. So again, there's no change in the effectiveness of the pill. There's nothing wrong with the woman's uterus. It's just the fact that the estrogen dose is so low that the lining hasn't gotten thick enough to shed.
Great.
We also see that, by the way, with the 24 active pills. It's very common for women not to get a withdrawal bleed on those pills.
Okay. The next question I want to address is, how do I determine my VESET when I'm on the pill? So this refers to the mandatory time to separate from relations when you're expecting your period to come. And when you're off the pill, governed by your natural cycles, there's a whole calendar which helps you determine when it might be that your period would come halachically for you to separate. But when you're on the pill, your period is completely controlled by the pill. So your VESET will be determined by the pill alone and not the calendar. So what you would look for is when you get your flow from your last active pill. Like if your last active pill was on Sunday and you will look, I get my period Monday to get it Tuesday morning, Tuesday night, and that would be your VESET. Once you establish a pattern 3 months in a row, that's the VESET that you would be mindful of going forward. The last question I want to bring up here is, I get this question a lot, especially from kalas who are just starting on the pill for the first time, and they might be having some spotting or some other side effects, and they're wondering, when should I switch to another pill, or should I switch to another pill, or will this get better?
Yeah, that's a good question. So there are bleeding patterns that are variable on birth control pills. And in general, we say it can take 3 months for your body to get used to a birth control pill. It does help if you start the pill with your period to reduce initial spotting. So we do recommend waiting 3 months before switching pills. However, if the spotting is not getting better after 3 months, then I do recommend switching to a different pill, typically with a higher estrogen or a different progestin. The other thing that I occasionally will recommend if the spotting is really not improving is to double up on the pill for a period of a few days to try to stabilize the uterine lining. So the next contraceptive we wanted to talk about was the NuvaRing. So the NuvaRing is actually very similar to a birth control pill in that it has both estrogen and progesterone. It's just delivered slightly differently. So instead of in a pill that you take every day, it's a vaginal ring that's placed in the vagina and left in place for 3 weeks. So then you take the ring out at the end of the 3 weeks and then you get a period. So very similar to the way the birth control pill works. It, it has a lot of the same benefits, side effects of the birth control pill. The main differences are, a woman using it, you don't have to take a pill every day, so that's a big benefit. You do have to be comfortable putting the ring in and out of the vagina. And compared to the birth control pill, it does give a more constant hormonal dose. So with the pill, you're taking a pill every day. So you get a lot of the hormone and then it goes down before you take the next dose. With the NuvaRing, it's very constant because it's constantly being absorbed by the vaginal tissue. And because of that, some women do experience less spotting with the NuvaRing compared to the birth control pills. There is a new ring on the market. It is a year ring that you get one for the whole year, and then you put it in for 3 weeks and take it out every month to get a period. It is a little bit bigger, so someone may not like that, but it is interesting and something to keep an eye out for.
So some halachic questions that come up on the ring are as follows. The first one is, do I need to remove it for bidikot? These are the internal checks that we do leading up to the mikvah. So ideally, it should be removed for the hefsek tahara for one badika on the first day and then one badika on the last day, 7th day of Shiva Nekim. If you forgot to do it, or there's a reason why that would be hard for you, let's say you're spotting and you don't want to you want to remove it, then you should speak to your halachic authority as to what to do. Do I need to look at it when I remove or replace it? So if you're just removing it and replacing it, you don't have to look at it. As I mentioned before, one area what we're strict about is anything internal. So if you would find red blood that's from the uterus on the NuvaRing, that would render you nida. So it's best not to look at it if you don't have to, except on the days where you're doing bidikot, then you should be looking at it. What about removing it before the mikvah? So in general, we try to remove everything before the mikvah. So in general, the NuvaRing should be removed as well. However, if you didn't remove it or there was a reason not to remove it, the mikvah immersion would still be valid. But you should discuss that with your halachic authority. And the last question is, can I skip the ring-free week? Similarly to the placebo question, can I put the new one in right away and not get my period? So again, halachically, that would be okay. You might run into a situation where you're off schedule with your insurance, right? If your insurance is expecting you to have this NuvaRing for 4 weeks, but you're only using it for 3, eventually you're going to be off with it. Is it possible to leave it in for longer, or is something? What can you do about that?
Yeah, good question. So the NuvaRing is obviously marketed so that you leave it in for 3 weeks, take it out for that 4th week to get the period. But it actually has enough hormones in it that you can leave it in for 4 weeks and it will still be effective. So if you wanted to use the NuvaRing in such a way that you didn't get a monthly period, you could leave the NuvaRing in for 4 weeks, take it out, put a new one in after 4 weeks, leave it in for 4 weeks, put a new one in, and you would still be protected. So the hormones are still good for 4 weeks. So the next contraceptive we wanted to talk about is the birth control patch. So the patch is very similar again to the birth control pill in that it has both estrogen and progesterone together. The difference is that these hormones are delivered transdermally, meaning they're delivered through the skin. And it is a patch, you can see the picture of it, that's put on the skin and it's changed weekly. So similar to the NuvaRing, the hormones are delivered in a steady dose. It has similar side effects to the birth control pill. There have been some reports of increased blood clots with the patch in certain women. So the patch may not be right for all women, especially women who are overweight. So it is something to discuss with your doctor.
halachically, the patch needs to be removed before the mikvah. And you can't put the same one back on, right? Because the hormones is in like the glue. And once you remove it, it just doesn't have the same hormonal strength. So it does require you, either you can time your switching of the patch with your mikvah, or you have to use an extra one every month. We'll move on now to the next category of birth control, which is the progesterone-only options. We'll talk about the progesterone-only pill, Nexplanon, and Depo-Provera.
So the first thing I wanted to talk about was the mini pill, the progesterone-only pill. So we've been talking all about combined birth control pills, meaning they have estrogen and progesterone in them. But there is an option for a progesterone-only pill, meaning it only has the progesterone component. And it works slightly differently. Because if you remember, what I told you is that the way that the birth control pill works is that the progesterone prevents ovulation. And part of the way that works is that the estrogen component of the pill helps to make the progesterone more effective. So the progesterone-only pill works differently because it only has the progesterone. And the main progesterone pill on the market, or the mini pill, has a progesterone called norethindrone in it. And because it only has the progesterone in a fairly low dose, it does not reliably prevent ovulation. So because of that, it has to work via other progesterone effects, like on the cervical mucus, sperm motility, other things like that. So because of that, it is not quite as effective as other birth control pills in preventing contraception. And also because of that, you have to take it in a very tight window. So other birth control pills are a little bit more forgiving. You can take it pretty much, every day. It's okay. We try to tell you to take it around the same time. The progesterone-only pill, you really have to take it within 3 hours of the same time every single day, or else it's not effective. The other differences with the mini pill are that there is no placebo week with it. So most women will still get a regular period because you are ovulating. However, some women will get irregular bleeding on the mini pill, and it is much harder to control because you don't have that estrogen component to stabilize the lining. The mini pill is commonly used in women who are breastfeeding, who may not want to take estrogen, and other women who have contraindications to estrogen. So like I mentioned, there are some associations of estrogen with blood clots. So women who are at high risk of blood clots should not be taking estrogen-containing birth control pills. Women who have migraines with aura also should not be taking birth control pills with estrogen. And there are other medical complications, or women with other medical conditions that should not be taking estrogen-containing birth control pills. There is a new progesterone-only pill on the market. The brand name is called Slind. It is a drospirenone pill, which is a different type of progestin. And it, it's still relatively new, so we're still learning about it, but it seems to, address some of the problems that the mini pill has. So it's a higher dose progesterone only pill, which is much better at preventing ovulation. And it is associated with less irregular bleeding. So it does have that placebo week. So women can schedule their periods by getting, taking the placebo week at the end of the cycle. And there doesn't have that narrow window of efficacy, so you don't have to do that 3-hour window for taking it. So this is a newer option, but definitely something to consider for women who cannot take estrogen.
On the halachic side, managing spotting is the main question we get on the progesterone-only pill. One tip of advice is to take the pill at exactly the same time of day, like even narrowing that 3-hour window to be within 10 minutes or something, if you can. That would minimize your spotting. I remember when I was studying to be a yoetzet and I was shadowing yoetzot on the hotline in Israel, one evening, every question began with, I'm on Cerazette, which is the progesterone-only pill in Israel, and I'm spotting, et cetera, et cetera. So definitely is a common side effect. Because of the spotting, we definitely recommend, if you're beginning the progesterone-only pill postpartum, to only begin it once you've gone to the mikvah. Otherwise, it might make it hard for you to count the 7 clean days.
The Nexplanon is another progestin-only option. It's an implant. It's put in the arm. So it only has progesterone in it, and it stays in for 3 years. And it's a very effective birth control. So, it's long acting. There's no pill that you take every day, and it's extremely effective at preventing pregnancy. However, the Nexplanon has some drawbacks. I would say the main drawback is that the bleeding pattern on the Nexplanon is very unpredictable and irregular. So this is because the progestin that's in the Nexplanon it prevents ovulation, but it doesn't prevent the follicles around the egg from developing. So the estrogen levels are very variable. And because of that, the uterine lining is unstable. So you really cannot predict when you're going to bleed on the Nexplanon and for how long and how heavy. So it's just a very unpredictable bleeding pattern, which can obviously be problematic halachically and also personally can be very challenging for patients.
Yeah, it's not a common choice that I see women using who are using the mikvah. I did have one kala for whom this worked very well, so it's possible, but not as common.
Depo-Provera is another progesterone-only option. It's an injectable progesterone. It's medroxyprogesterone acetate, which is a very strong progesterone. So it is so strong that it does suppress ovulation. You take it every 3 months. Because it's so strong at preventing ovulation, most women do not get a period, and a lot of women will find that their bleeding pattern stabilizes after a few months just having no bleeding at all. It's also very good for pain control, so women who have endometriosis or other conditions that cause pain find this to be very effective. However, because it prevents ovulation, it also suppresses estrogen production. And because of this, it's associated with short-term bone loss. And there are some other side effects with Depo-Provera, including weight gain and depression that you should be aware of if you're choosing this method. The other thing that's important to know about Depo-Provera is that it is very strong at suppressing ovulation. So it is so strong that it actually takes 1 to 2 years to completely clear from the system before you begin ovulating again. So for women who want a birth control that they will, stop and then immediately get pregnant, I would not recommend Depo-Provera because it can take 1 to 2 years after you stop before you can conceive.
Let's move on to IUDs. I get a lot of questions about IUDs. They are an increasingly common form of long-term birth control. The most common IUD that women who call me use is the Mirena, but the copper IUD is also a popular choice for women who want reliable, effective birth control that don't have any hormones.
So let's talk first about the copper IUD. So the copper IUD is one of the very few long-acting, effective contraceptives that we have that has no hormones at all. So the way it works, it's a little device. It sits in the uterus, and again, has no hormones. So it's just made out of copper. And that little device creates an inflammatory environment in the cervix, fallopian tubes, and uterus that prevents pregnancy. So it's extremely effective. It can last for up to 10 years. And because there's no hormones, there's very few side effects. So it's a great option for women who cannot take hormones. For example, women who've had breast cancer or women who have contraindications to hormones for other reasons. The main side effect of the copper IUD are longer and heavier periods. And this is because of the inflammatory environment in the uterus. So that can be problematic for women who already have long and heavy periods. It can make them longer and heavier. So that's something to be aware of.
Yeah, this can be challenging for women who are, using the mikvah to have longer and heavier periods. I mentioned before, if you're just spotting, there are all sorts of leniencies that we can apply. But if it's a real flow, then that wouldn't make you there's not much to do about that.
Now, the progestin IUDs are extremely popular and also a very effective long-acting form of contraception. So the one you probably heard about the most is the Mirena IUD, but there are other progestin IUDs on the market, which we'll discuss. So the progesterone IUDs, they have a progestin called levonorgestrel, so it's a synthetic progesterone. And what it does is they give us a high amount of this progestin directly to the uterus in the form of the IUD. So again, the IUD sits in the uterus. The difference between this IUD and the copper IUD is that it's embedded with the hormone, so that the hormone is released directly to the uterus. That helps to keep the uterine lining thin. So in contrast to the copper IUD, most women with the Mirena IUD or another progestin IUD will have no period at all, or if they do get bleeding, it will be very light. So women will either get, short, light periods, some unscheduled bleeding that's light, or no periods at all. So like I mentioned, it's very effective, and you can keep it in the uterus for up to 5 years. All IUDs can be removed at any time. So even though they say up to 10 years, up to 5 years, they can be removed at any time. And the return to fertility is immediate. So as soon as you take them out, you can get pregnant the next cycle. Now, one of the benefits of the progestin IUD is that even though it's a hormonal contraceptive, the hormones are local, meaning they're really just distributed to the uterus to keep the uterine lining thin, but very little of the hormone reaches the blood. So because of that, there are much fewer side effects than with other hormonal contraceptives. So all those things we mentioned before, mood changes, weight gain, depression with the Depo-Provera, nausea, we don't see those with the progestin IUDs. However, because the uterine lining is thin, we do see irregular bleeding and spotting, and it can take women several months to normalize their bleeding patterns. So while many women will experience no periods at all, and many women will just have, light cyclic bleeding, some women will continue to have irregular spotting. We also see some pain after insertion, and it can take a few weeks or even months for the body to get used to it. There is another IUD that's very similar to Mirena called Liletta, which is pretty much exactly the same size and dose.
As I mentioned, I get a lot of questions about IUDs. So let's talk about first the procedure of putting it in and taking it out. So this applies to both copper and progestin IUDs. That when you have the IUD inserted, it's very common to have some bleeding. According to many opinions, this is not considered a dam nida. It's considered a dam maka, which means blood from a wound. That would not render a woman nida. If you weren't bleeding before the procedure, the doctor used a tenaculum to grasp your cervix, and then the doctor said you might experience bleeding. Oftentimes, this lasts for like a day or so after the insertion. And similarly, when it comes to removal, it's considered dam maka as well, that the removal itself caused the bleeding. It wasn't, considered dam nida. Another question that comes up a lot with IUD is about the spotting, especially when you're getting used to it, which can last for several months for women. And it's really important to review the laws of staining to make sure that you're not becoming nida unnecessarily from seeing spotting from the IUD. Now, what gets a little bit confusing with the Mirena IUD is that sometimes it's not just a bit of spotting, but it's also not a flow. It's like heavier spotting than normal, more than just a bit of breakthrough bleeding you would have on the pill. And it's a kind of a confusing category where it's like not a flow and not a stain. And what I like to use like the panty liner test, which is, can you wear a panty liner all day and not worry about it? That's considered spotting. If you have to wear something heavier, like a pad or a tampon, that is what we would call a flow. And it gets more confusing when you often have this in a cyclical pattern, similar to the low estrogen pills, when you're spotting or having this little bit of bleeding, lighter, once a month, right? So again, on the one hand, some halachic authorities say this is your period for you. Even if it's just spotting, this is your period. And others say, no, as long as it's just spotting, it doesn't reach the threshold of a flow, it's not considered nida, and you're not nida from this bleeding. Again, similar to the progesterone-only pills, because of this spotting, we recommend inserting it postpartum after the mikvah to allow you to get to the mikvah more easily. And sometimes people ask me, like, I'm going crazy here. Like, what is there something I can do about this spotting? So on a medical side, can you do anything about it?
Yeah, good question. So I always think about the IUD as a base. So the IUD is in place. It doesn't mean that you can't take other hormones on top of it. So if women are having, a lot of difficulties with spotting, we can always add hormones to stabilize the uterine lining. So the progestin IUD keeps the lining very thin. So if the spotting is an issue, you want to do something to thicken the lining and stabilizing it, which would be estrogen. So you can either add estrogen pills alone, or you can even add a short course of a birth control pill. to stabilize the lining. So usually just a couple of weeks is enough to get the uterine lining thicker, and then the bleeding will resolve. So there are a few new IUDs on the market. These are smaller IUDs with less progestin in them. There's the Skyla that is marketed for up to 3 years, and the Kylena, which is also a 5-year IUD, but it is a lower dose. So, these IUDs are just as effective as the Mirena IUD, but because they do have a lower dose of the progestin, the women in the studies did not have as much what we call amenorrhea, or total lack of period. So just something to be aware of with these IUDs, they probably will have more spotting and unscheduled bleeding. There are some IUD myths we wanted to address. So, one of the myths that I hear a lot is that if I've never had a baby, I can't have an IUD. So that is not true. I can put an IUD in anyone's uterus. You do not have to have had a baby before to have an IUD as a contraception. It's very, easy to place, and, anyone can have it even if they haven't been pregnant before. Another myth that I hear is that an IUD is going to make me infertile or affect my fertility. That is also not true. IUDs are safe, and they do not affect future fertility. In fact, they're one of the contraceptives that as soon as you take it out, you can get pregnant right away. So that is another myth that I hear a lot. So the last topic that we wanted to discuss is barrier methods. So barrier methods are not as effective as hormonal contraceptives, and certainly not as effective as the longer acting methods that we talked about. But there are certain situations where, couples may find that these are things they want to use. Spermicide is just something that's added to barrier methods to make it more effective. There are male and female condoms. Condoms are the only thing that is out there to prevent sexually transmitted diseases. Diaphragms are placed over the cervix to prevent the sperm from getting in. Sponges and caps are generally not as effective as other methods like diaphragms. Permanent sterilization, vasectomy would be for the male and tubal ligation for the female, are obviously extremely effective means of contraception. They are permanent, and I'll leave it to Sarah to talk about whether these would ever be halachically permissible.
Yeah, so that's a good question. So according to most opinions, diaphragms, sponges, and caps are permissible. Again, there are differing opinions here. Condoms are generally not permitted. But, again, it's always worthwhile asking a question. If there's a reason in your specific situation, it might be recommended, but by and large, not permitted. And same with permanent sterilization, which again, perhaps under extreme circumstances, under medical advice, it would be the right thing to do halachically for you. So it's always worth asking, direct questions to your halachic authority to figure it out. One tip about the diaphragms, sponges, and caps, if you're using them, is that similarly to the NuvaRing, you don't want to look at it when you take it out. You can take it out, wash it in the sink with the lights off, look away, because if you do find any blood on the diaphragm, that would render you nida because it's internal.
So in conclusion, there are many contraceptive options available. If one does not work for you, ask your doctor about other options. There are many options.
And on the halachic side, just a reminder again that not all blood is nida. Always ask a question if you do have spotting to see if this kind of spotting renders you nida or not.
And your needs may change during your lifetime. So just because one method worked for you during one stage of your life, it doesn't mean that's going to be the right method for you later in your life. So, make sure that you learn about all your options so that as your needs change, you have other options available to you.
So thank you very much for being part of this session, and we would love to answer any questions that you have now.
All right, I see one question. So the question is that on the Mirena, the patient was told she would have no period, but now she's getting more frequent bleeding than she was before after about 2 years, like about every 3.5 weeks. So is this normal? So I think this speaks to the question that we were talking about with Mirena, though. Any bleeding pattern is really normal. The Mirena IUD does not prevent ovulation reliably. And especially after having the IUD in for, 2 years or so, you may ovulate on it and get a period about every month. So it is possible that, having light bleeding every month is just a period. Now, halachically, the question is, does this actually make you nida? So I think the question is how light the bleeding is, and I'll leave that to Sarah to talk about whether or not that makes you nida. But medically, if you're getting a period, if you're getting light period every month, it's probably because the Mirena is not preventing ovulation, and that's actually your period.
Yeah, I think the question of the lightness of the period is really tricky. Again, I think different halachic authorities have different approaches to this. So that would be something I would recommend that you speak to a halachic authority about directly. Another question I see, I think this is for you, Rachel, is I got my Mirena removed and I got a second period, and now I'm bleeding heavier than I used to before the Mirena. Is that normal?
So I think that probably depends on how long the Mirena was in place for. A lot of things can change that can cause women to have heavier periods. So if the Mirena was in for many years, you don't really know what your periods would have been like, if the Mirena wasn't in for 5 years. So, I think there are certain things that can cause heavier periods that require medical attention. Things like, hormonal things like thyroid or other hormonal changes, or structural issues like polyps. So if it's really, heavy, that's concerning, or irregular, definitely should be evaluated by a doctor, maybe with ultrasound or blood work. But just having the period change in, being lighter or heavier, that can be normal variation, just due to age, weight, or other changes in life.
A question came in, are IUDs effective at preventing pregnancy?
So yeah, I think IUDs are probably one of the most effective birth controls that we have. There have been studies showing that they are as effective as permanent sterilization. So they are very effective. And one of the things about IUDs is that there's really no user error. Birth control pills, you might forget to take a pill. NuvaRing, you might forget to put it in or take it out. Obviously, condoms and diaphragms are, user dependent. But with an IUD, really, it's you put it in, as long as it's placed properly, it can't change. So that's one of the reasons why it's really so effective.
Another question, can you share more about why condoms are not halachically permissible? Again, so there's two concerns about condoms. So the first one is an issue of spilling seed or having semen, not be going into the vagina. It goes into a condom. So that's one issue. Another issue is kind of interfering with the natural intercourse. Whereas something like a IUD, intercourse is exactly the same, whereas a condom, both female or male, that is interrupted and there's a barrier there. And whereas diaphragms or sponges or caps, which are kind of higher up in the vaginal canal, according to other authorities, many authorities are permissible, but there are other ones who, say it's not permitted for the same reasons.
So a question came in that was interesting is, why don't men have birth control? I think that's always a challenging question. I think that there have been studies trying to develop a male birth control, but it is very challenging. Sperm and egg development, completely different scientifically. And in order to reliably prevent sperm production, it's a lot more challenging hormonally. But that is something that science is working on, but it is definitely a more challenging scientifically than having female birth control. So there's a question, I think, about scheduling periods with birth control pills. And the question is, can you take 4 days of placebo instead of 7? So the answer is yes. So really, when it comes to birth control pills, the placebo pills are not needed. So, if your body does well with, say, 4 days of placebo instead of 7 days of placebo, that is totally fine. In fact, that there are many birth control pills that are marketed with 24 active pills instead of 21 active pills. So, you may ask your doctor just to prescribe you a birth control that has 24 active pills. So that way, that is just the way the pill pack comes. But you don't have to take all 7 days of placebo. So you could take 24 active pills and then move on to your, give yourself 3 days or 4 days off and then move on to your next pack. That is fine. there is no medical need to ever take any placebo pills on the birth control pill. Like I said, sometimes patients need that break to prevent themselves from having breakthrough bleeding. But from a medical perspective, you could be on birth control pills continuously and it would be fine for your body.
Another medical question for you is Mirena compatible for those women who cannot tolerate estrogen and or breastfeeding?
So that's an excellent question, and the answer is yes. So there is no estrogen in the Mirena IUD. So women who have contraindications to estrogen can be on the Mirena, and it is a great choice for women who are breastfeeding because there's no estrogen in it, and it does not manipulate the hormones. It does not have any impact on breast milk. So yes.
Another question about condoms. The female condom, is that permitted halachically? Again, generally no, for the same reasons as a male condom. But for sure, ask your own halachic authority on that. So if it isn't necessary to have a period medically, why is that common to do for women who don't have mikvah considerations?
So, it's an excellent question. I think a lot of women want a period every month. I think they like that reassurance that they're not pregnant, that their body's still functioning normally. So I think that there are some women who just like having a period. I think also, like I said, some women can't, give themselves more than, say, a month or two off of not having a period before they get breakthrough bleeding. So I think that some women, just find that with their bodies, it's just easier to get a period every month and know that it's coming rather than, worry about having that breakthrough bleeding if they go longer than a month. But I have to say, I have a lot of patients who are on continuous birth control pills, whether it's for pain-related reasons or hormone-related reasons, who I never have them get a period on the pill. I just have them take it continuously for a year or longer, and they do fine on it. So there are plenty of people who do not get a period at all on the birth control pill.
Do you have a recommendation for the best tampon on the market?
I don't have a specific recommendation. I mean, I know a lot of people like all natural products, so you can look for something like that. I think the main differences are going to be applicators versus non-applicators. If you're someone who's not comfortable with tampons because, you find them uncomfortable, I would look for one that has a plastic applicator. I think the rounded plastic applicators like the Pearl tampon from Tampax are really easy to put in. If you're someone who does not want an applicator because you think it's bad for the environment, OB tampons are super easy and and friendly because they can just be put in without an applicator and a finger. I have to put in a plug though here, if you're asking me about menstrual products, for a menstrual cup. Okay, just bear with me for a second because it is a very sanitary and easy way to deal with periods. And if you've never tried one before, you actually really might like it. It's harder for women who've never, I think, had a baby, maybe to place it. So, you might find it harder than tampons. But for other women, menstrual cups are making a resurgence, and they're really easy to use, and you might actually like it if you try it.
I saw this question. I want to clarify. Someone's asking why the female condom is permitted. So I said it's not permitted, similarly to the same reasons why the male condom is not permitted. So I want to clarify that. Let's do a question from you. So why is missing 2 or 3 pills a risk for contraception, but missing the placebo pills, so 4 or 7 of them, is not?
Excellent question. So the active pills are what make the birth control pill work. So they are the hormones that are preventing your body from ovulating. So if you miss more than 2 of those pills, you're risking that your body may not get the right hormones, and then you might break through and ovulate. So if you miss the active pills, then you're worried that the pill might not be effective. The placebo pills, there are no active ingredients in those pills. All those pills are doing are giving your body a break from the hormones, letting your body not see the hormones, and not seeing the hormones is what lets your body have a period. So the placebo pills are really just there to let your body have a break from the hormones and have a period. So you don't need to have a break from the hormones. You don't need to have a period to make the birth control pill effective. You do, though, need to take the active pills to make the birth control pill effective. So if you miss the active pills during the time when your body might be ovulating, it's a problem. If you don't take the placebo pills, it's okay because you've already prevented ovulation. So that's why missing the placebo week is okay, but you cannot take any chances during those active pills.
See, I think so. This question is both medical and halachic components. So it's, what advice do you give a woman who frequently has breakthrough bleeding on many various forms of birth control, is constantly bleeding or spotting, and she can never get to the mikveh? So
yeah, you want to address the halachic question?
I'll say a halachic answer, then I'd love to hear what you have to say medically about it. So on the halachic side, I would say there's two things to think about here. The first is the spotting causing her to be nida or not, right? Because again, not all spotting makes you nida. So it's very possible that the breakthrough bleeding you're having actually never causes you to be nida, so you don't need to go to mikveh over that spotting that you're seeing. If you do see spotting in a way that makes you become nida, now we have the challenge of counting the 7 clean days leading up to the mikveh. And here it's important to be in touch with your halachic authority if there's things you can do to make counting the 7 clean days easier. That could involve reducing the number of bidikot that you have to do, not doing them twice a day, doing it once a day, or only doing it on certain days, let's say the first day and the last days. That can entail wearing colored underwear instead of white underwear during the 7 clean days, which again, normally we wear white, but in situations where there's spotting or other extenuating circumstances, you don't have to. So there are things you can do to help you get to the mikveh, or even if you are experiencing a bit of spotting. On the medical side, yeah.
From the medical side, I would say like no woman should ever be experiencing that much spotting that you can't get to the mikvah. Like I would say that's a problem. And I would say that, if you were coming to see me as a patient, I would really try to work with you to try to find a birth control that doesn't give you that much spotting. There are things that we can do to manipulate the cycle. We can give you more estrogen. We can give you more progesterone. There are things that we can do where if we're not happy with one method, we can switch to another. I do have some women who it seems like whatever birth control we do, they bleed. But I'm usually successful through trial and error in finding something that works. Sometimes I have to be creative, doubling up on the pill, doing a combination of things like an IUD plus a birth control pill. Sometimes I do, to get them to stop bleeding. So there are ways of making sure that you don't bleed. Now, I will say, if you absolutely are bleeding through absolutely everything, it's important that you make sure that your doctor evaluates to make sure there's no structural issues like polyps or other hormonal issues that could be the cause of the bleeding.
I think we're out of time. Do you want to? Yeah, I believe so. Looks like there's more questions. We're happy. I hope we answered a lot of your questions this evening. And I hope that this gave you some knowledge, both medical and halachic, to bring to your doctor to have a more informed conversation and to determine, which birth control option is best for you.
Thank you so much. This was so much fun.
Thank you.